Welcome to H&HN Daily's Delivery Transformation Series. I'm Hayden Bush, Senior Online Editor for Hospitals and Health Networks magazine, and I'm here today with Alan Channing, President and CEO of Sinai Health System in Chicago, to discuss some of Sinai Health System's innovative patient safety and community health initiatives. Alan, thanks for joining me today.
It's a pleasure to have you at Sinai.
Why don't you start off by telling us a little bit about the Sinai Health System and some of its communities it serves?
Well, Sinai Health System has served this particular community for going on 92 years now, and got started as a place to serve immigrants. Mm-hmm. In those days, it was immigrants from Eastern Europe coming to Chicago and to the west side of Chicago to find jobs and housing. As the community's developed over time, it's continued to serve immigrants. After World War II, there were immigrants coming from the southern part of the United States, and the community turned to become mostly African American. And then in more recent days, been serving immigrants from south of the border. So half of the community is now African American, and the other half is Latino.
And Sinai Health System, even given its payer mix, has managed to land in the top 10% of hospitals in 93% of core measures. Can you tell us a little bit about how you achieved those numbers?
Shortly after I joined the Sinai Health System, which is about 7 years ago now, the board started to raise questions about how we were looking at our quality, and we're really measuring things in an appropriate way. And we were struggling with it. And they said, well, this is really important to us. So the first thing we did was actually join the premier quality program, and gave us some access to resources there. But really, what it came down to was our board of directors saying to all of us, management, medical staff, leadership, and nursing staff, that quality was going to be a major focus. So the vision is to be the national model of how urban healthcare is delivered.
Right.
And one of our core values is quality. So you put those two pieces together, if we're not addressing it, we're not being true to who we say we are.
And in terms of the vision, what do you see that model looking like in terms of being that national model?
You can look across the whole health system and see pockets of where we have actually achieved that. Mm-hmm. And I'll give you an anecdote. In our labor and delivery area, in the postpartum unit, we have a payer mix there that's virtually all Medicaid. So this is, obviously an economically challenged community. And lots of young people who have no resources at all. But we have a nurse's aide who's worked here for 15 years or so, who has made it her job out of her own pocket to see that every mother goes home with a new outfit for her baby. To us, that's the key. I mean, people would think about a hospital with a payer mix like Sinai's, and just, I mentioned the OB service, but if we look at the whole institution, 60% Medicaid, mm-hmm. 20% Medicare, 7% commercial insurance, and the remaining 13% is uninsured. So when you think about that payer mix, and then you layer on the quality statistics that you described, go, Sinai, on the west side of Chicago, you can do this? Well, we can, because people have said, I believe in the mission, I believe in the vision, I want to make it happen.
And you've also received quite a bit of attention for your Urban Health Institute and some of the work you've done to reduce chronic conditions like asthma and diabetes. And going forward, what are some of the areas you'd like to tackle next?
So Sinai has two very unique programs. The Sinai Community Institute, which has 25 different community-based activities, ranging from pregnant and parenting teens all the way up to senior citizen programs. And the Sinai Urban Health Institute, which is a group of epidemiologists studying what's happening out in the community, and then coming back and saying, okay, we've heard this from the community, we see these issues, how do we work with the community to respond to that? So we've characterized this part as pre-primary care. And as you said, we're addressing chronic care conditions, asthma, diabetes, congestive heart failure, all the things that describe an urban population. But you can't deal with those without dealing with education, without dealing with housing, without dealing with the knowledge base that the people have to impact on their care. We learned that as providers, we were doing a terrible job educating patients and their families. So you have a family member who has asthma. What do you know about that? Well, the doctor said there was a problem with their breathing. What about your medication? Oh, I don't remember. So we learned that what we had to do was go back and re-educate.
Mm-hmm. So that would be your advice to hospitals with similar payer mixes, whether they're urban or rural, that they really take a step back and learn more about the community before they go forward with a quality or a community health initiative.
Well, I'd say it goes beyond that with hospitals that may just look like us. I'd say it's for every hospital, every provider, that if they're not connecting with their community in an open and transparent way, then they're not fulfilling that vision I've seen the AHA put up when they put up their vision statement that includes community as part of that, and as Rich Umbenstock talks about the community health issues.
Well, Alan, that's all the time we have for today. I want to thank you for joining us today.
My pleasure. Thank you.